Welcome to the very first ever Dr. J Q&A. If you do have some questions, you can write them, type them in your chat box, and they'll show up here. We're going to go through, we're going to be talking about some thyroid stuff and a little bit on cholesterol. We had a question on that, and we'll see what else comes up. So for those of you who don't know me, I'm Dr. Jeremy Ipson with Santan Natural Medicine, naturopathic medical doctor, working hard to help people be healthier in a natural way. I obviously won't be able to answer every question that you may have. Some of them are on a more personal nature, and so we would need to have an actual visit online or in office. So if you want to do that, you can call our office with our phone number there listed. We're in Gilbert, Arizona. You can find more information on our website, or a great place to find out or to follow us is, if you haven't already, to like us on Facebook, our Santan Natural Medicine page. We try to be active, posting different things on there. And making sure that we have good quality health information out there for everyone. So the questions, so we had a few questions that came in and definitely hear very often. So I'll just go ahead and read through them, and then we'll just dive in. So these are the questions about thyroid. So when I Google my symptoms, the best answer that I can find is that I have low thyroid, but my doctor said all my lab tests are normal. Am I crazy? Number 2, what is thyroid hormone? Very good question. Number 3, and my doctor said my thyroid level is low, put me on Synthroid, but I don't feel any different. So these questions are very common. I hear them often. Thyroid is very important, and so that's why it comes up a lot with symptom-wise with Google. Google likes low thyroid. It's a very common search result, and there's a reason for that. And we'll understand a little bit more about thyroid and a little bit more about the different thyroid medications. Okay. So this is kind of just a brief diagram showing what's going on with your thyroid. Your thyroid gland is in your neck here. It's kind of a little butterfly-shaped gland right here. And it produces multiple hormones. The main ones that we know about are T3 and T4. Others we're learning more about as time goes on, but T3 is definitely the most active one. And the T4 in the body mostly ends up converting to the T3. So that's what the main hormone we're talking about. Every cell in your body has thyroid receptors and needs the thyroid, the T3 receptor, to activate and to turn on the metabolism for that cell. So T3 stands for, big long word, triiodothyronine, which is why we call it T3. It's much simpler. And like you said, it helps every cell that you have. So in your brain, for example, your cells that are in your brain, helps them with memory, with focus, with recall. For your muscle cells, it helps with energy and function. Liver cells helps to detoxify. Digestive system helps your digestive system to move more slowly. So definitely a very important one. So, okay, whoa, jumped ahead of myself there. So that's kind of answering the what is the thyroid hormone. Of all the hormones all balance together. The thyroid is probably the backbone. That's what the main one that we need to get balanced and focused, or other hormone treatments might not even be any good at all. So definitely important. So there are multiple things that can go wrong with thyroid. Thyroid can be low for many reasons. And so going back to that first question about having all the symptoms of thyroid, that is very common, but then thyroid levels are still low. So thyroid, some of the common symptoms with low thyroid are low energy, fatigue, weight gain, depression, just moods being decreased, digestive issues, dry skin, dry hair, dry nails, brittle nails. Definitely, like it says, almost any symptom you have in your body could be caused by low thyroid because of the way that thyroid works with every cell in your body. So it's definitely important to have. So it's definitely also, with all that big list of symptoms, a very common thing, like I said, to pop up on Google. So are you crazy thinking that you might have low thyroid when your labs are normal? No. Most doctors use a normal range for thyroid labs, and normal people are tired and gaining weight and have no energy and are depressed. So in my practice especially, I don't just use the normal range. I think there's a more fine fine-tuned range where it's much more effective, helping people feel better. And so that's kind of what I call the optimal range. So for thyroid levels, it's towards the higher end of the normal range. When TSH, which is kind of a screening for thyroid, as you can see here, that's a lab test. It's very common use for screening. We like that one on the lower end. We're not going to dive into that now. That would be a question for another time about why high TSH number means low thyroid. But anyway, so a lot of doctors just live in that normal range, and that's why a lot of people, even though they might be close to the high or the low end of one of those lab results, they might just not feel good, and they just need to be a little bit tighter control with their thyroid. And sometimes just giving them a little small dose of thyroid medication can make a big, big difference in their life. So I see it all the time, multiple times per day. So that leads us to the next question, or that third question on there. You started a thyroid medication and have not noticed the benefit. So this is very, very common. I think, especially in the conventional world, they're kind of limited with what they do with thyroid. They use the synthetic thyroid hormones, which for medications, which are T4 only. So the Synthroid, the levothyroxine, all of that, those medications and their generics are T4 only. A lot of times people have issues converting the T4 to the active form of the T3. This is kind of what it's shown here, one way that that's prevented with stress and high cortisol levels. So we have much better results doing kind of a more natural thyroid hormone medication. Usually we use Armour thyroid or Nature Thyroid, which uses a combination of T3 and T4. Your body's making both T3 and T4, and so giving your body only T4 doesn't make a lot of sense, which is why I like the Armour, because you have both the T3 and T4 close to what your body would naturally be producing. It tends to sway on the Armour a little bit more towards T3 than what your body is normally producing, which is actually fine because T3 is the one that most people are low in. So important one. So that answers those questions there. And I see that doctors mismanaging thyroid patients a lot. People not noticing the benefits that they should be feeling while on thyroid medication. So sometimes it's simple as talking to your doctor, see if they can switch your medication. If they won't do that, then it might be a sign you need to find a different doctor. But that's for you to decide. So that's kind of our quick overview on thyroid. All right, so our website is a great way to stay up to date with santannaturalmedicine.com. And also on Facebook, we have a Santan Natural Medicine page.